Hello friends and Assalamu alaikum. I am Dr. Mariam Hussain and I'll be discussing the consequences of early extraction or exfoliation of permanent first molars. Now as we all know that permanent first molars are one of the first permanent teeth to erupt into the oral cavity. And there are a number of causes that lead to the early exfoliation of permanent first molars. I'll make sure that we discuss those in another video. But for now on, let's move on and discuss the problems that arise if the extraction space is not timely replaced. So the first problem that arises is the alveolar bone loss and ditching of alveolar bone. Now the alveolar bone basically gets its functional stimulus from the tooth in the socket. And if the tooth is extracted, it leads to the remodeling and resorption of alveolar bone, leading to the ditching between the second premolar and the second molar. Now this ditching poses a lot of problems at a later stage. If, for example, the permanent second molar is to be moved orthodontically into the extraction space at a later stage and there is ditching, it will take a lot of time and also there will be less bone available. Also, if this extraction space with the ditch is to be replaced with a prosthesis, for example a denture, it might lead to the problems of stability. Now the second problem that occurs is the mesial tipping of second molars. Now tipping is basically the movement of the crown in one direction and the root into the opposite direction. And mesial tipping would only occur if the second molars are fully erupted. No bodily movement can occur if the second molar is fully erupted. Mesial drifting or the bodily movement only occurs if the permanent second molar is not erupted or it is in the Nolla stage of 6 to 7. Then there are a lot of chances that it might drift into the extraction space. Now the fourth problem that occurs is the food impaction and spacing between the premolars. Now there is a lot of space adjacent to the second premolar and the second premolar also starts to tip into the extraction space, causing space in the first and the second premolar. Now there is a space in between the first and the second premolar which leads to food impaction, gingivitis, and then it might lead to periodontitis and periodontal diseases. Now the fifth problem is supra eruption of the opposing teeth. Now for example, I have extracted the lower first molar. So the opposing upper first molar starts to supra erupt because there is no occlusal stop. And it starts to supra erupt and it continues to supra erupt until it reaches a stable occlusal stop. Now the drifting of the teeth into the extraction space, the tipping of the teeth into the extraction space, and the supra eruption of the opposing teeth all lead to the unevenness of the occlusal plane. Also, the last problem that I'll be discussing is the rotation, mesiopalatal rotation of the maxillary second molar around the palatal root. Now this could occur because in the upper molars we always have three roots, okay? And the palatal root might act as an axis and the tooth might rotate around the palatal root and move into the extraction space mesiopalatally. Now this thing cannot occur in the lower molars because the lower molars only have two roots and there is no rotation in the lower molars. Okay, so now we will be discussing the possible replacement options. I'll be discussing 4 of them, starting off with the first one. If the patient is in the growing age, we are never going to advise the patient with the fixed partial denture. Okay? The fixed partial dentures, the implants, the bridges are to be given to the patient only if the patient is not in the growing age anymore. And if the patient is in the growing age, then we'll give the patient the removable partial denture until the patient crosses the growing age, and when he crosses it, then we can give him the definitive treatment, which is the implant prosthesis or the bridge prosthesis, or we can also go for the orthodontic closure of the space by moving the second molars and the third molars into the extraction space. So that's it for today. Thank you for watching and have a nice day.